It is a common misconception that a woman cannot get pregnant during her period. While it is less likely to occur at this time in her cycle, it is certainly not impossible. The menstrual cycle is a complex biological process regulated by hormones. It typically lasts around 28 days and is divided into 4 phases, beginning with the first day of full menstrual flow. After menstruation, the body begins to prepare for ovulation, referred to as the follicular phase. Hormones stimulate the growth of follicles in the ovaries, each containing an egg. Around 14 days into the cycle, a mature egg is released from the follicle and travels down the fallopian tube. It is the most fertile time of the month. If the egg is not fertilized, hormone levels drop and the uterine lining sheds again, starting a new cycle. The average menstrual cycle lasts 28 days. However, menstrual cycles can vary in length. They can be shorter, longer, or irregular, making it possible to ovulate earlier or later than usual, even during a period. Factors such as hormonal imbalances, stress, weight gain or loss, intense exercise, poor nutrition, smoking, drug use, genetics, and other lifestyle choices can influence the timing of the cycle, complicating the prediction of ovulation and fertility. Women with shorter cycles, less than 28 days, are more likely to ovulate soon after their period ends. For instance, a woman with a 21-day cycle might ovulate around day 7. If her period lasts 5 to 7 days and she has unprotected sex toward the end, sperm can survive for up to 5 days, making it possible for fertilization to occur if ovulation happens shortly after. Sperm can remain viable in the female reproductive tract for up to 5 days under optimal conditions. Sperm needs moisture to survive. Drying out quickly, exposure to air and extreme heat or cold outside the body shortens its lifespan, reducing survival time to minutes or hours. The alkaline environment during ovulation protects sperm and extends its viability up to 5 days. This means that sperm introduced toward the end of menstruation may still fertilize an egg if ovulation occurs within that time frame. This emphasizes how timing, even during the menstrual phase, can influence the likelihood of pregnancy. Another factor that increases the risk of conception during menstruation is mistaking ovulatory bleeding for a period. Some women experience light spotting during ovulation, caused by hormonal changes as the egg is released. This spotting is usually light pink or red and lasts 1 to 2 days, making it easy to confuse with the start of a period. As a result, unprotected sex during this time could occur during a highly fertile window. While the chances of getting pregnant during a period are lower, they are not zero. If avoiding pregnancy is the goal, it is important to use contraception consistently, regardless of the timing of the cycle. For those trying to conceive, tracking ovulation through methods like basal body temperature or ovulation predictor kits can help identify the most fertile days. Understanding your body's cycle is essential for making informed decisions about reproductive health.